Oh gosh, my life was full. Teaching, that was a really big part of my life. That's a very physical, demanding job. Bending, twisting, leaning, probably every motion you can think of. I love gardening. I loved working in the yard, from mowing the lawn to planting flowers to pulling weeds. Just basic stuff that you really take for granted until something happens to you. And you know, my life really just kind of came to a complete stop.
What happened was unrelenting back pain, encroaching on nearly every aspect of Christine Zoghbi's life.
You know, just a simple movement, maybe taking something out of the oven, or if you've dropped something on the floor, you know, bending over to pick that up is probably going to put you in excruciating pain.
When Christine first came to me, she clearly had a significant back problem. She had tried a lot of other treatments. She was very reluctant to even think about surgery, as most people are. But it was affecting her life and her activities of everyday living to a point where she really now had to explore doing more drastic interventions.
Dr. Scott Boden heads the Emory Orthopaedics and Spine Center. He is a leading expert in complex spinal procedures, spine fusion, and a chief researcher in the use of bone growth factor.
I really only wanted the best. So I began my research online, as everybody does these days, and Dr. Boden's name popped up. And he, I believe, is in the top 5% nationwide on this type of back surgery.
Hello.
Hello.
How are you?
There are some back problems that are very amenable to surgery, and others that surgery has a very small chance of helping, and in many cases can actually aggravate or make them worse.
Dr. Boden was great. His first comment was to me is, after I look at everything in your MRIs and really, you know, go over your file, we want to do everything but have surgery. You know, that's his last step for patients.
But Christine's back problem was more serious.
Christine had a problem that required, in addition to taking the pressure off of her nerve roots or unpinching her nerves, it required us to fuse two of her spinal bones together. It's really very important that each patient is treated separately, and they're more than just an x-ray. It's how it's impacting their life and what the nuances of their physical exam. And those are some of the things that make a successful surgery or an unsuccessful surgery.
The thing that I really liked about the Spine and Orthopedics Hospital is, you know, that's all they do.
We basically took a blank piece of paper and had the unique opportunity to redesign an entire hospital from scratch. We redesigned everything centered around the patient and their family. We now do bedside rounds 2 or 3 times a day so that the patient and their family hear the nurses and the physicians talking about what's the care plan for the day, what are the issues, what are the concerns, and that allows them to both ask questions, know what's going on, and potentially even catch oversights before they happen. One of the unique aspects of the Emory Spine Center is that we have 16 physicians here, and they do nothing but take care of patients with all spine problems. We have physical medicine and rehabilitation physicians. We have occupational medicine physicians. We have psychologists. We have neurosurgeons. We have orthopedic spine surgeons, all seeing patients within a few feet of each other, which enables us to get a second or third opinion in minutes without the patient even having to leave the exam room.
Christine's progress is continually and carefully monitored. The medical team at Emory Orthopaedics and Spine Center was there to make sure she knew exactly what to expect during her recovery.
And then I hit the 6-month mark, and that was really the turning point for me. I could find myself being active all day. That was really where I started to feel like myself again. And then after that, it just kept getting better and better. And now, a year out from the surgery, I'm back to myself 100%.
This video was made possible by generous donations from Emory healthcare employees and the community. To make a gift that makes a difference to patients and families, please call 404-712-GIVE. Thank you.